Triglyceride test is one test which everyone has to be done. Triglyceride to glucose index is you take a fasting triglyceride from the lipid profile, multiply with the fasting blood sugar, divide it by 2 using a noggin calculator. There are 2 calculators. If the 2 number is inside the bracket, then it will be 4.3. If the 2 is outside the bracket, it will be 8.5. This indicates insulin resistance. What is insulin resistance is post-receptor insulin signaling is lost. So the muscles feel weak. Every organ feels thirsty as the glucose is not inside. Glucose will be circulating in the blood and the insulin will be there at very high levels. As the peak of insulin goes on increasing, it causes glucose-lipid toxicity. So these people at the age of 20 years, you can make out 30 years ahead of whether he will develop complete lipotoxicity, only cardiac event like myocardial infarction, or they develop glucose event like diabetes mellitus, or a combined event of diabetes with hypertension with dyslipidemia with the heart attack. So triglyceride to glucose index, very cheap test, can be done at every center with triglycerides into glucose divided by 2. And when you use it for waist circumference, it has been proved that all people who are having waist circumference more than 85 centimeters, it is correlating well with the high triglyceride to glucose index and insulin resistance. Similarly, waist circumference to height ratio more than 0.8, it indicates that the patient is becoming obese and the insulin resistance has started. This is nothing but a hidden diabetes. Chance of getting a full-blown diabetes and heart attacks are very high. So I request every public to ask the doctor and also the doctors from all specialties to get a triglyceride to glucose index test immediately. Thank you. From nephrology, neurology, cardiology, oncology, diabetology, if you take any branch of medicine, common factor is insulin resistance. So by making out insulin resistance 20 to 30 years ahead, we can make out whether the patient can develop cancer, or in gynec cases or young girls, whether they develop PCOS, that is polycystic ovarian syndromes, or infertility. And later on, these same drugs, women later on, they develop diabetes or hypertension, dyslipidemia, coronary artery disease, or brain stroke. Everything can be weighed out by knowing out insulin resistance. This can be weighed out by fasting insulin to fasting glucose, or you can use a triglyceride to glucose index. Fasting insulin to fasting glucose divided by 25 is called as Fury test. Fasting insulin to fasting glucose divided by 405 is called as HOMA-IR, homeostasis model assessment of insulin resistance. Triglyceride TYG index is fasting triglyceride to fasting glucose divided by 2 using a login calculator. If it is more than 4.3, it indicates insulin resistance. So by finding out insulin resistance, it applies to all specialties. Every doctor must, and every patient and every Indian should understand to get a triglyceride to glucose index test done and find out the insulin resistance.